All right, welcome back. So, here we have a 48-year-old man who presents to the clinic after returning from a 2 week business trip to a developing region in Western Asia. He reports persistent watery diarrhea for the past 4 days, with up to 1,000 bowel movements per day. The stools are loose and bloody, malodorous, and vary in color between light brown and green. He also complains of abdominal bloating and excessive gas. He has been taking over the counter antidiarrheals, but they have not improved his symptoms. He denies any fever, nausea, or vomiting. On examination, he appears well, with normal vital signs and no signs of dehydration. Abdominal palpation reveals mild tenderness and distension, but no cutting or rebound. Bowel sounds are present and active. FOPT is negative. Okay, so for this, let's just look through the question. So it's important to note the age of the person, right? And that he was on a trip to Western Asia, right? So you kind of get the stereotypes in questions on the USMLE, which is kind of weird, but they can actually help in questions, all right? So you also need to note the type of diarrhea it is, whether it's watery or bloody, okay? And some other things to note, whether there are any systemic symptoms like fever, all right, which he doesn't have. He has normal vital signs as well. And you need to note the FOBT. Now, the FOBT will tell you whether it's bloody or non bloody diarrhea. All right. So, for the answer for this is E, right? E-tech. Now, remember, E-tech is the one that you get where you travel to places that have poor water sanitation. Okay, so they might throw in Latin America in there or something like that. Again, it's weird, I know, but yes, they might throw that in. And you also need to remember that there are these two toxins that come with ETEC, right? So we've got the heat stable, right, and the heat labile ones, right? The heat stable acts by increasing cyclic GMP, right, and the heat labile by cyclic AMP, increasing cyclic AMP. Okay, now let's take a look at the other options. Campylobacter jejuni, this is the one that's linked to poultry. Like, so if you don't cook poultry properly, then you could end up with this, right? It gives you a bloody diarrhea, right? So bloody diarrhea. And let's just put poultry here. Poultry. Okay. Now there's a connection that I like making with Guillain-Barré syndrome. Okay. So Barré. Okay. So Guillain-Barré syndrome. So this is where you have the ascending paralysis. So this can come as a complication of having Campylobacter jejuni infection. All right. Now C. diff is notorious, right, for its odor. It's malodorous. You can see in this patient. Okay. C. diff though, you usually see in questions recent antibiotic use, especially something like clindamycin. Okay, so antibiotic, right? Because the antibiotics will clear out the quote unquote good bacteria in the gut, right? Leaving stuff like C. diff to proliferate. Okay, and then they can also link like pseudomembranous colitis, which is part of what you would get with C. diff infection if it's not treated on time, right? So it's like a complication of C. diff. Now, entamoeba coli is like something they can just throw out there. It doesn't really do anything, to be honest. It doesn't really have any effects per se, right? Entamoeba hirsutica, this one can give you like a bloody diarrhea. All right, so that's what we will use to differentiate it from this. The non-typhoidal salmonella also gives you a bloody diarrhea. Okay, norovirus is the one that's linked to cruise ships, right? So it will probably throw in like a cruise ship question on there. So if someone has like diarrhea with vomiting and that sort of thing, yes, that's probably norovirus, or it can also be called Norwalk virus, right? Rotavirus that affects like toddlers. Okay, so it's not really an adult disease, and it will give you diarrhea and vomiting. And Shigella gives you a bloody diarrhea. Okay, Yersinia enterocolitica is the one with the pseudoappendicitis, right? So it also it affects toddlers. It gives like a pain mostly on the left side. So it's a weird thing. All right. Okay. Have a good day.